Webinar.
Audio recording for this meeting has begun.
Text, staffing and supervision for antiretroviral treatment and access to services.
Welcome. This module is intended for managers of the Antiretroviral Treatment and Access to Service program, ARTAS. This is the third of 4 self-paced mini-modules and focuses on elements of ARTAS and readiness for implementation. This presentation is the result of a collaborative effort of 4 capacity building assistance providers. B.A. Laris from ETR Associates, Armand Lours from JSI Training and Research Institute, me, Melanie Graham from the New York City Department of Health and Mental Hygiene, and Sarah Jane Rath from Proceed.
ARTAS for Managers 3-stage support process.
As you know, by this point in the process, we have designed the series to support supervisors and managers who oversee programs that are implementing the public health strategy of ARTAS as a part of the CDC-funded initiatives for high-impact HIV prevention. This is a 3-part series that includes a live webinar and provides an overview of all of the key information managers need to know to support their ARTAS staff. A series of 4 self-paced mini-modules to provide more detailed information on key components necessary to support the successful implementation of ARTAS. This module is one of the 4. Finally, a live technical assistance session when managers and supervisors have access to a panel of skilled capacity building providers to answer questions and help troubleshoot any issues or concerns.
An image of a man wearing a Superman shirt.
What is my role? As a manager, you are probably wondering what your role is with ARTAS. We like to think of this in a few stages. Getting started, what to consider when becoming familiar with ARTAS, and when deciding to implement the intervention. Pre-implementation. The agency makes necessary changes, plans for necessary human and monetary resources, builds relationships with community partners, creates a marketing plan, and develops a monitoring and evaluation plan. Implementation. Issues that the implementing agency staff will focus on while implementing ARTAS. And lastly, maintenance, integrating ARTAS into existing services, continuous work to adapt, monitor, and evaluation of the intervention, as well as to make necessary changes. This is laid out in great detail in the ARTAS implementation manual as well.
A woman's scarf resembling a cape.
As we mentioned, there are lots of details in the ARTAS implementation guide, but today we're going to highlight a few key ideas that we think are the most helpful for managers in the implementing phase of ARTAS.
Text, objectives.
Today we're going to cover staffing and supervision for ARTAS. And after you complete this module, review staffing models, examine different strategies to supervise linkage coordinators, and understand organizational capacity needed to supervise linkage coordinators. Let's begin.
ARTAS goal. An image of a chain.
The goal of ARTAS is to assist persons who have been recently diagnosed with HIV getting linked into care for the first time. ARTAS can also help persons living with HIV re-enter care after prolonged absence. ARTAS is a multi-session approach that focuses on the needs of each client individually. It's important for managers to understand the goal of the approach as well as its process and structure in order to be able to effectively support linkage coordinators in their efforts.
Text, sample staffing plan, list of salaried positions and FTEs.
The staff positions to consider when implementing ARTAS are the program director/manager, LC supervisor, and evaluator, as many linkage coordinators as needed to serve the population based on a caseload of 25 to 30 clients at any given time, and a contract manager if the implementing agency is a health department contracting out the implementation of ARTAS. We're going to highlight a few of these positions which are specific to ARTAS. Every organization identifies the best staffing plan that works within their own capacity and resources. But this is a common area and a suggested area for organizations that are juggling multiple roles and responsibilities to seek feedback.
Program Director Manager 25 to 40%. Next slide. The Program Manager, Fiscal Management, Hiring and Managing Staff, Monitoring the Intervention, Reporting.
The Program Director/Manager is responsible for the overall implementation of the intervention, including providing leadership both internally and externally, assessing the agency's capacity to implement ARTAS, providing fiscal management, which includes identifying and securing necessary resources, hiring and managing intervention staff, managing and monitoring the intervention, including ensuring fidelity, writing or reviewing reports required by the funding agency, approving the marketing plan and materials and the monitoring and evaluation plan and materials, obtaining internal support for the intervention, obtaining external support and participation from community partners and HIV care providers as needed. If the program director/manager also serves as a contracts manager at a health department, they'll be responsible for the overall grant management and procurement process. They'd be responsible for collecting and reviewing any required deliverables from the subcontractors, CBOs or ASOs, and maintaining regular communications with them.
The LC supervisor, supervise linkage coordinators.
The linkage supervisor plays a crucial role in supporting the linkage coordinator in the day-to-day implementation of ARTAS as well as activities to support the core elements. And the linkage supervisor is responsible for supervising the linkage coordinator and other case managers, coordinating activities with the program director or manager and evaluator to monitor quality assurance and fidelity to implementation, reaching out to community partners and HIV medical care providers as needed, facilitating the communication between the ARTAS staff and other agency staff, especially with non-ARTAS case managers, to minimize conflict. Using a strengths-based approach to supervision to model and reinforce behaviors for the linkage coordinator, conducting regular staff meetings and case staffing meetings, monitoring the activities and accomplishments, barriers faced by each linkage coordinator, making the initial contact with community partners and providers, especially if the linkage coordinator does not have an existing relationship with the potential partner. The linkage coordinator supervisor should have a strong background in social work and case management, strong clinical skills, and excellent understanding of boundaries, knowledge of community, regional, and state resources available like Ryan White services and ADAP, and have knowledge of HIV prevention, care, treatment, and counseling. Experience with motivational interviewing techniques, specifically responsive listening, is useful but not required. The supervisor should be knowledgeable about the strengths-based case management, which may include previous experience or training, and must be supportive of a strengths approach to link people to medical care and supervision.
The linkage coordinator.
The linkage coordinator is also responsible for recruiting eligible clients for ARTAS, screening recently diagnosed patients for eligibility, conducting client sessions with a caseload of 25 to 30 clients at any given time, conducting active community-based, strengths-based case management, developing and implementing a marketing plan for ARTAS, creating marketing materials to educate potential community partners, building and maintaining effective working relationships with community partners, working closely with case managers and social workers in both a medical and community setting to coordinate medical care, conducting data collection and entry, maintaining careful and accurate documentation for all contact with ARTAS clients. Regardless of the type of agency implementing ARTAS, the linkage coordinator supervisor and the linkage coordinator should be located at the same agency. Additional part-time positions may be required depending on the agency's implementation plan. Potential positions include a communications person, a graphic designer for the marketing materials, or a receptionist who will greet clients as they come into the agency.
The heart of ARTAS.
But beyond the tasks or the official job description of a linkage coordinator, it is important to remember the linkage coordinators are really the heart of your program. In ARTAS, the linkage coordinator helps the client learn new information, such as the benefits of accessing medical care, and discuss strategies to achieve the client's goals. During sessions, the linkage coordinator may discuss strategies to overcome barriers to visiting an HIV care provider. The linkage coordinator and client may practice or role-play interactions between the doctor and patient, if that is helpful to the client. Building working relationships with providers such as testing centers and community partners in order to build and maintain referrals.
Capacities.
Potential linkage coordinators benefit the most from the formal ARTAS training when they possess basic skills, knowledge and experience, including fundamentals on counseling, basic motivational interviewing, responsive listening techniques, HIV testing, counseling, prevention and treatment. Linkage coordinators will learn a new set of skills during the formal ARTAS training that builds on these fundamental areas, As mentioned before, ARTAS focuses on the needs of the client and prepares linkage coordinators with tools geared to empower clients in their own linkage to care. Linkage coordinators will learn the strengths-based approach and effective ways to implement an initial strengths assessment with clients. Linkage coordinators will also learn the proper facilitation of a continuous strengths-based approach. A formal ARTAS training also enhances the linkage coordinator skills to assist and motivate clients to their own plan using SMART objectives. During the training, linkage coordinators also learn how to prepare clients for transition. Lastly, the coordinators also study and practice effective ways to debrief after medical appointments. As you can see, ARTAS is an approach that asks from the linkage coordinators personalized attention and effort.
Supervision for success.
Supervisors generally are asked to address 3 different areas in the supervisory capacity. 1, quality assurance, 2, communication and information, and 3, supportive environment. The supervisor plays an important role in ensuring that the LC implements the intervention with fidelity. Regular supervision of the LC is one of the most important activities to successfully implement an ARTAS. Supervision is important because it allows the LC to gain knowledge, skill, motivation, and commitment, which in turn can prevent burnout. Supervision is also used to ensure the effectiveness in the LC's role and collectively discuss strategies to get the clients into care, build skill, ignite motivation and commitment, which can deter the burnout, strategies, boundaries. Now, important features to remember on supervision are the following. Consistency, meeting weekly or biweekly depending on your preference, and reviewing documents. If clinical, address boundaries and countertransference.
Types of supervision.
There are many different models or ways to talk about supervision. In the context of most CBOs and ASOs implementing ARTAS, we're going to only discuss a few types of supervision. As a manager, you will need to consider the needs and priorities of your program. CBO providers are able to support you to design supervisory systems that make sense for your program. The types of supervision consistent of administrative, clinical, supportive, and multidisciplinary. Depending on your organization's capacity, really dictates the type of supervision to be conducted with the LCs. Supervision types can be provided by different staff, depending on their qualification and the need of your organization.
A trust fall. Text, administrative supervision.
For administrative supervision, the primary goal is to ensure adherence to the agency's policies and procedures. The primary issue or problem in administrative supervision is the lack of adherence to agency policies and procedures. For educational supervision, the primary goal is to increase knowledge and skill, with the main problem being lack of knowledge and or skill resulting in poor or inadequate performance. Within the support supervision domain, the primary goal is to improve morale and work satisfaction, as the primary issue is the lack thereof and the impact on the work.
A word cloud includes efficiency and output.
Administrative supervision focuses mostly on monitoring the LC's caseloads, specifically referrals. It also works on time management with peers and mostly boundaries on and scope of work issues. Administrative supervision is far more surface than other versions of supervision. At the most fundamental level, your goal is to support the linkage coordinator in his or her efforts to link clients to medical care. To promote that goal, you should support each linkage coordinator to maintain adherence to the core elements of the intervention. Guard against intervention drift, which refers to returning to a pre-ARTAS deficit-based state of mind, and support staff in documentation, skills building, and execution. Interactive supervision should take place on a regular basis and not only in response to a problem or a crisis. The ARTAS implementation manual includes the Linkage Coordinator Supervisor Guide with detailed sections to help support and guide you in this process. In particular, for administrative supervision, there are suggestions for implementing strengths-based supervision, regular staff meetings, and supervisors' formal or informal meetings with clients.
The next slide shows a flow diagram.
The ARTAS Client Flow Diagram is a useful tool for managers and administrative supervisors for a simple picture of the ARTAS process and the responsibilities of the linkage coordinator. We are going to talk in a little more detail about 3 critical elements of ARTAS so that you as the manager understand the core tasks of your staff. These are recruit clients, deliver ARTAS sessions, link to care. The graphic can be downloaded at the end of this module.
Text, client recruitment.
Client recruitment depends on how ARTAS is integrated into your agency's services. Potential strategies include available through testing programs, partnering with testing sites, inter-agency collaboration and partnerships, marketing ARTAS, collaborating with local health departments, seeking capacity building assistance, SEBA. Providing an overview of ARTAS will be one of the best recruitment tools. This includes time and session limited, goal, link newly diagnosed individuals to medical care, benefits, better health outcomes, reduced transmission, more people linked to medical care, clients identify strengths and overcome barriers, assistance, i.e. providing transportation, childcare, a session plan which includes goals and tracks progress, location, time and day of the client's choice, and transfer clients to other needed services.
ARTAS session overview.
Session 1, building the relationship activities. 1, introduce the goals of case management in ARTAS. Next, discuss concerns about recent diagnoses. Begin to identify personal strengths, abilities, and skills to assess others' role in impeding or promoting access to the services. Encourage linkage to medical care. Summarize the session, the client's strengths, and agreed upon next steps. Last, plan for the next session with the medical care provider. Strengths-based approach and the relationship between the LC and the client help increase retention and the success for the client. It's important to spend time in this phase. The LC does not need to rush through this.
Session 2 to 4.
And then for an overview of sessions 2 through 4, in these 3 sessions, they're very similar, where we're identifying strengths and setting goals and removing barriers to linkage. And specifically, there are 6 elements that are similar through all of these sessions, sessions 2, 3, and 4. And those include that soliciting client issues and questions from the previous session, continue to identify personal strengths, abilities, and skills, encourage linkage to medical care, identify and address personal needs and barriers to linkage, summarize the session, the client's strengths, and the agreed upon next steps, and finally plan for the next session or with your appointment of linking to medical care. The strength-based approach and the relationship between the linkage coordinator and the client help ensure the retention and success for clients. It is important to be responsive to the needs and the pace of the client.
Session 5, completing the work, linkage to care.
During Session 5, this session focuses on completing the work, and it includes 3 activities: reviewing the transition process for clients linked to medical care, reviewing the transition process for clients not yet linked to medical care, and transitioning to long-term Ryan-White case management or other providers. The strengths-based approach and the relationship between the linkage coordinator and the client help increase retention in ARTAS as well as retention in care. And the long-term relationship between the client and the linkage coordinator leads to long-term success for the client. Not every client needs the same number of sessions or the same amount of support from the linkage coordinator. This is a personalized strategy where the linkage coordinator works individually with the client to support linkage to care and retention in care through the use of strengths-based approaches and also goal settings.
Linkage to care.
The ultimate goal of ARTAS is to link clients to medical care. The linkage coordinator can often help this process by explaining the benefits of linkage to care, describing the process and what is to be expected from linkage, giving referrals to medical care that your agency trusts and has relationships with, and answering any lingering questions or concerns. The linkage coordinator may help make an appointment, may accompany the client to the first visit, and may check in after the visit to see how it went. During the ARTAS sessions, there are several linkage outcomes. Client decides to link to medical care and schedules an appointment. Client already linked to medical care and reviews the appointment during the session. Client links to long-term or Ryan White case manager. And the last one is client does not want to link to medical care and has unresolved barriers.
Improving professional skill and competence.
Clinical supervision is a formal process of professional support and learning that enables individual practitioners to develop knowledge and competence, assume responsibilities for their own practice, and enhance patient protection and safety of care in a wide range of situations. Now, in a formal discipline working alliance of the supervisee, clinical work is reviewed and reflected upon, with the aims of improving the supervisee's work with the client, ensuring client welfare, supporting the supervisee in the relation to their work, and supporting the supervisee's professional development. We use the term clinical supervision as distinct from administrative supervision to describe a process intended to support workers in a human service organization to better provide a more confident and creative service to the clients. In this case, the primary focus is the actual doing of the work and how workers can extend themselves in relation to their practice. Now, for example, clinical supervision requires a licensed clinician who has the capacity to discuss transference and countertransference with LCs appropriately. Clinical supervision has more of a therapeutic approach, which focuses on the LC's transference, the client's unconscious feeling towards the peer, and the countertransference, the LC's unconscious feelings towards the peer, all of which can affect the dynamic between client and LC. Features of the clinical supervision include ensures the client's welfare, which in relation to clinical safety and competence, professional and ethical standards, and organizational service delivery protocols, thereby functioning as a risk management tool. It provides a safe environment that is professional and confidential, that promotes the development of specific skills and competencies to bring about measurable outcomes and growth for you as a therapist. Now, as you insist on the acquisition of complex clinical skills, expanding one's clinical practice, competence, and confidence is a critical component of development for a therapist. Without, we are a danger to our clients and our own professional conduct and growth. Improved communication, client and/or team cohesion, safeguards against worker burnout. Now, at the most fundamental level, your goal is to support the LC in his or her efforts to link clients to medical care. Promote that goal, you should provide fresh, creative, and strength-based solutions to barriers the LC are encountered with clients. And then lastly, support the LC to maintain a strengths-based perspective as he and she encounters challenging clients and works with various deficit-focused settings. Interactive supervision should take place on a regular basis and not only in response to a problem or crisis. The ARTAS implementation manual includes a linkage coordinator supervisor guide with detailed sections to help support and guide you in this process. In particular, for clinical supervision, there are suggestions for implementing strengths-based supervision and case meetings.
Supporting, sustaining, motivating.
Supportive supervision. Within the supportive supervision domain, the primary goal is to improve morale and job satisfaction, as the primary issue is the lack, therefore, and the impact of the work. Now, supportive supervision doesn't necessarily need a licensed clinician, but a supervisor who has the capacity to still address transference and countertransference and boundaries and make an appropriate referral if needed, all while addressing paperwork, documentation, and client strategies. Now, supportive supervision builds on the LC's strengths, provides individual support to the LC coaches in their LC role with the clients and professional growth. Supportive supervision can be a mix of administrative supervision and aspects of clinical supervision that's appropriate. At the most fundamental level, your goal is to support the LC in their effort to link clients to medical care. To promote that goal, you should, 1, support the LC to maintain adherence to core elements, and lastly, support the LC to maintain strength-based perspectives as they encounter challenging clients and works within a various deficit-focused setting. Interactive supervision should take place on a regular basis, not only in the response to a problem of crisis, like I mentioned before. The ARTAS implementation manual includes a linkage coordinator supervisor guide with detailed sections to help support and guide you in this process. In particular, for supportive supervision, there are suggestions for shadowing and coaching exercises.
Multidisciplinary supervision.
Within prevention and care settings, collaboration among professional counselors and other helping professionals from other disciplines is often necessary, and the professional functions of each often overlap in the work setting. Yet, misperceptions about training backgrounds, professional practices, and roles can impact working relationships. These meetings can lend to the ability to synthesize experiences and expertise, building a richer understanding of clients and a deeper sense of collegial support. While work environments are inherently multidisciplinary by the composition of staff representing various training disciplines, that does not mean that collaboration is necessarily taking place. There is a tendency for helping professionals to remain in their separate silo and to defend their professional training and practice. These can conjure a spirit of competition, not collaboration, and a context within which strengths of the various training disciplines are not being maximized through intentional efforts to work together to provide best client care. Some characteristics of collaborative treatment include merging of expertise, division of labor, working with colleagues, and distribution of power, with the hope that the combined knowledge and skills that result from multidisciplinary collaboration will support the generation of new and creative treatment approaches to best meet the varied needs of clients.
Multidisciplinary care team.
Now, multidisciplinary care teams are groups of professionals from diverse disciplines who come together to meet varied patient needs. ARTAS clients have very diverse needs. The linkage coordinators will need to feel comfortable working across disciplines to help the client address their identified needs and meet their goals that are preventing them from linking to care. Multidisciplinary teams meetings can help build relationships to best meet the needs of clients.
Supervisor responsibilities.
Across all types of supervision, there are key standards or responsibilities of a supervisor. To be accountable to one's own profession for ensuring adequate standards, to give clear accounts of one's model philosophy and goals in the supervision process, to treat the supervisee and the supervision process with respect, to provide clear and constructive feedback to the supervisee in an ongoing way and during annual performance evaluations, to prepare adequately for supervision, to be clear about confidentiality and any limits to this, to provide both support and challenge to the supervisee appropriately as they advance their learning and development with the client's interest, provide and promote opportunities for the supervisee's skill development relevant to the supervisee's clinical role, provide clear professional boundaries regarding the supervision relationship, provide ongoing opportunity for the supervisee to reflect, critically evaluate different aspects of your work, ensure one's own supportive and professional development, and maintain appropriate records.
ARTAS coaching conference, supportive, administrative, clinical, multidisciplinary team.
In a group of professionals from diverse disciplines who come together to provide a comprehensive assessment and consultation for ARTAS clients is what we call the ARTAS coaching conference. While their primary purpose is typically to help the linkage coordinator resolve difficult cases, teams may fulfill a variety of additional functions. They can promote coordination and referral between agencies, identify service gaps, and breakdowns in coordination or communication between interagency programs, outside agencies, or individuals. They also enhance the professional skills and knowledge of the linkage coordinator by providing a forum for learning more about the strategies, resources, and approaches used by various disciplines. When implementing ARTAS coaching conferences, there are a variety of factors that need to be considered. Again, think about what your organization's capacity is. Can this be folded into case conferencing your organization already conducts? Why reinvent the wheel if it doesn't have to be? ARTAS Coaching Conference is a group of professionals from diverse disciplines who come together to provide comprehensive assessment and consultation for ARTAS clients. While their primary purpose is typically to help the linkage coordinator resolve difficult cases, teams may fulfill a variety of additional functions. They can promote coordination and referral between agencies, identify service gaps and breakdowns in coordination or communication between interagency programs, outside agencies, or individuals. They also enhance the professional skills and knowledge of the linkage coordinator by providing a forum for learning more about strategies, resources, and approaches used by various disciplines. The purpose of the conference is to provide the linkage coordinator with support and strategies from different disciplines and perspectives in order to holistically understand the client and effectively link them to care. ARTAS coaching conferences take the best of both supervision and multidisciplinary team meetings and meld it into one meeting. The linkage coordinator is supported and focused on much like traditional supervision with the expertise and perspective of multiple disciplines, again, like in the multidisciplinary team meetings. When thinking about the ARTAS coaching conference, some organizations are going to integrate them into their current KEYS conferences. This will give them a specific opportunity to talk through difficulties with specific clients or with groups of clients. Some of the interesting discussion points that can be talked about in the ARTAS coaching conference are what are the unique risk factors, barriers, or problems identified by the client that's preventing linkage to care. Also, what are some clients using as their strengths that other clients have not thought about? Some of the strategies that are recommended by the ARTAS coaching conference from team members can help each linkage coordinator think about new and appropriate strategies. The linkage coordinator will then take the steps to identify how the recommended strategies could be executed with the client during their next session.
Next mini module available, ARTAS evaluation and adoption.
And finally, to help you gain more knowledge on how you and other managers can gain more detailed information on key components necessary to support the successful implementation of ARTAS, we invite you to participate on the fourth and final mini module in this series. There we will provide more detailed information focused on monitoring and evaluation and adaptation for ARTAS. If you would like to access the fourth mini module now, click on the link provided in the pod shown here, which says links. We look forward to it. Thank you.
A list of files to download and access resources appear within the webinar.